So my name is Marco Lepri. I'm a research engineer in the biomedical AI group at NEC Laboratories Europe, where we focus on applying AI to healthcare, biomedical and drug development applications. Differential diagnosis is a standard approach used by doctors and clinicians to distinguish between different diagnoses for a patient that may present with very similar symptoms. It usually involves redacting a list of possible diagnoses according to the patient's current symptoms, and then trying to systematically rule some out by performing some decisive tests to decide if a condition is present or not, or by collecting more information about the patient's symptoms or current conditions. Differential diagnosis usually involves or requires a lot of knowledge and very deep knowledge about many different diseases or medical fields, knowledge that a lot of doctors may not have or may not be updated because this knowledge also evolves very quickly, especially in the case of rare diseases. It is also a very time-consuming process because doctors need to go through this diagnose, evaluate and update loop multiple times in order to come up with a good diagnosis for the patient. AI can not only speed up this process or automatize part of these processes, but also help with the doctor's reasoning or support the doctor's reasoning by, for instance, providing a broader range of possibilities that may be overlooked otherwise. Current differential diagnosis methods that use AI usually tackle a single step in the differential diagnosis process, like the knowledge retrieval or the diagnosis strategy, rather than trying to model the entire reasoning process that the doctors go through for differential diagnosis. Another problem is that they usually assume perfect knowledge of the patient's profile, which means their current symptoms, medical history or past conditions, which is of course an unrealistic expectation because patients usually can't explain very well their symptoms and don't remember everything perfectly. Another problem is that the current methods usually rely on single datasets for their evaluation, which impacts their generalizability to real-world applications, which of course makes it difficult for doctors to trust these systems and use them in everyday life. I believe AI has the potential to improve the efficiency and efficacy of our healthcare system, while at the same time tackling problems that we're currently facing, like the lack of doctors and clinicians. However, these systems are still very opaque and hard to fully trust, especially in a delicate field like the healthcare field. I think the next challenge for AI is that the systems should become much more transparent and compliant, so that the professionals can really understand the processes and reasoning that the AI systems are doing and really use them and steer them according to their everyday needs.